senator from Idaho if I could respond, because I was thinking when the senator from Tennessee was talking about the luxury taxes and how everyone thought that felt so good to have a tax against luxury boats, and who suffered? The workers. And then the catastrophic Medicare coverage, which resulted in a tax on seniors who were going to have that coverage, and seniors erupted, and that was repealed, and then followed on by the senator from Nevada who talks about the Cadillac plan, which is the high-end plan of coverage. And I thought, maybe Congress has learned something. Maybe the Democrats are onto something. They've listened to the history of all of these good-sounding taxes on rich people or people who buy expensive things. And as the senator from Nevada has pointed out, they've now learned that they really probably ought to go ahead and tax both ends instead of just the high end, because in this bill, you have a tax on the high-end plans. You have a tax on employers that provide too much coverage. Oh, but we also tax the people who don't have any coverage. So if it's too small, you get taxed. And if it's too big, you get taxed. So it seems like maybe the Democrats learned the wrong lesson. And it's not that you tax just the rich or the people who buy expensive things now, it's that you tax both ends to make sure that you get every little drop of taxpayer dollars. Well, I think we have shown on this floor from the endless hours of debate that everyone in America is going to be taxed, because the taxes that take effect in 3 weeks' time under this bill, January of 2010, the major tax increase takes place. And that's the tax increase on prescription drugs, on insurance companies who are going to have to raise their premiums. The drug costs are going to go up, and medical equipment, which is the essential for seniors, especially for everyone who needs some form of equipment. The equipment manufacturers are going to have the tax. So $100 billion in new taxes start next January, 3 weeks from now. So every person in America is going to pay taxes in the form of higher prices starting in 3 weeks. So then the senator from South Dakota and I are sponsoring the legislation, because the next question would be, oh, well, my goodness, if we're going to be taxed in 3 weeks, surely we're going to have some sort of benefit offered in 3 weeks, some sort of low-cost health plan or option. 3 weeks, surely. Oh, no. No, we're not going to have any of the plan that would offer options to people. Not in 2010, not in 2011, no, not in 2012, not in 2013, but 2014. So all these higher prices are going to start kicking in January, and then we're going to have the Cadillac plan that the senator from Nevada mentioned in 2013, all being paid before one supposed benefit would be available. If this is not a bait and switch, I've never seen one. And the senator from South Dakota and I are going to offer the next amendment after the ones that are in the tranche right now to just very simply say, whatever the bill is in the end, there will be no taxes until there is a plan. Not one dime of taxes could take effect until there is actually some sort of plan available that would hopefully give some sort of benefit to people, which is what is being promised. So I would just ask the senator from South Dakota if that's his understanding, that we would at least draw a line. And whereas Senator Crapo's motion, which I support, and I know everyone on the floor talking this morning supports, to say there will be no taxes to anyone who makes under $200,000. But even if there are taxes in the end, they won't take effect until there is some sort of plan available for people that is going to help Americans who don't have coverage and for whom we're not able to lower the cost, which is what the Republicans are trying to do. At least we would set that deadline. And I would just ask the senator from South Dakota what he's been hearing about this bill.
My colleague from Texas is exactly right. And